Are you struggling to get pregnant, have a healthy pregnancy to term, or overcome failed fertility cycles? There's usually five big reasons as to why that happens. The first is that no tests have been done to understand what is getting in the way. The second reason is that some tests may be done, but they're not the right tests. In fact, we could say that they're the wrong tests for what we need to ask and answer. The third reason is that some of the right tests have been done, but not all, and not deep enough investigation has been put in place to really understand the root cause of the problem. The fourth reason is actually to do with reading the tests the wrong way or taking reference ranges as ideal ranges that essentially don't give us the full information about what is optimal function within the body compared to suboptimal function and things just not actually being the way that they need to be to give you the best possible results. The fifth reason gets down to the fact that the treatment isn't correct for the level of testing that has been applied or not done at all. So either the treatment is missing or it's mismatched to what you're actually interpreting and seeing in terms of results, or because we don't have results, or it's just a case that's been mismanaged. Many things haven't been quite right to be able to actually get the result. Those are the five reasons why so many couples go around in circles for years. And I can say this because I have been treating couples to overcome infertility, recurrent miscarriage, and failed treatments since 2001. I have treated thousands of couples that finally went on to have a healthy baby because they understood the root cause of the problem. And then as a result of that, they've been able to change it. My name is Gabriela Rosa. I'm a fertility specialist. I'm a Harvard University awarded scholar. And the main thing that really gets me quite frustrated for my patients is this whole idea of not really having answers, right? So I wanted to change that. And that's exactly what we're doing this week. We have a program in my clinic called the Fertility Breakthrough Program, and it has been demonstrated to have a 78.8% live birth rate. Now, it's fully booked until March 2026. So I decided that there were lots of people that needed help, that needed this initial understanding of what diagnostic tests do I need to do to get a full picture and a full answer from my specific situation. So we brought out the fertility diagnostic report. And that is exactly what we do in the first stage of the Fertility Breakthrough Program to get the right answers that are going to then lead to the right interpretations and the right treatments. So what we're doing with the fertility diagnostic report, it's a one-off service. We will assess the entire situation, the entire case, put together a very specific and very focused testing protocol for you and your partner, and ultimately give you a letter of referral that you can take to your local doctor to be able to actually get the right tests and finally get the answers that you need. And from there, you can then choose to have further interpretation of results and or further recommendations. But that is the perfect start if you have been trying to conceive or keep a healthy pregnancy to term for a while and are faced with lots of roadblocks and you're not sure why things aren't working the way that they need to be working. Please be aware that this intake is happening for this week only, which means that either the week is going to pass and we're going to close the intake and we're taking on a maximum of 10 reports. These take a long time and a lot of expertise to put together. They are manually put together by really expert team that assesses the entire case piece by piece. And so ultimately we don't have a lot of capacity to deliver them, but for the people who are actually going to get it, it is a game changer. So if that's you, if you want answers, go ahead and click the bio link or comment answers and we'll get the information through to you. I look forward to seeing you on the other side.